Hi, this is Dr. Scott Conard. I wanted to get together and give you an update on what's going on with the COVID epidemic in the United States. It's obviously changing. It's very dynamic, and it's something that we need to pay close attention to as we make decisions about whether we get vaccinated or not. And I know there are a number of people watching this who have not made that decision yet. So I want to encourage you to look at the data, look at the numbers, look at what we actually know, and make a decision based on science. Don't make a decision based on opinions or op-eds or political views, because it's your life and this is important. So I'd really ask you to look at the data, and I'm going to present a lot of data to you. I'll try to keep you awake. I hope it's not too boring, but it's important for you to know. And one good thing is right now we see a huge uptick in the United States. A lot of people are changing their minds. They're going back. They're getting the COVID vaccine. And I say it's a good thing, not to push you, but to say that after I show you this evidence, I think you'll see that whether it's you that chooses to go get it or not, it's a big deal, and it makes a big difference for your friends, coworkers, family, and communities. So back in earlier in the spring, we were seeing a lot of these variants come up. Now, variants are a normal part of a virus. They have to change, mutate to stay ahead of the human immune system, or they'll just be extinguished. And it's a part of their normal activities. When the COVID-19 virus first came over from China, it had a very sloppy key to get into your cell. It didn't fit into a lot of cells, and that's why the first wave that came through, when people breathed it in, may have landed in your sinuses, and the COVID-19 viruses went up to your cells to try to get in, but the key didn't fit, and so you didn't get sick. With the UK variant, which is one that came up after that, we see that that variant got a better key. And so when it landed in the back of your sinuses, it could get in more cells, and so more people got sick. Unfortunately, this newest virus, the Delta variant, it's got a key. It's very, very good and very tenacious. So we're seeing many, many more people get sick. You hear it's 500 to 1,000 times more infectious. So it's really not good. And in fact, it's leading a lot of doctors to say, there are basically two groups of people in the United States: those that are protected from COVID and those that are going to get COVID, because this is really, really aggressive. So the CDC, to make it easier for us to keep track of all these mutants, and right now there's a large number of them that they're tracking and studying, is you have a variant of interest. That means they discover a new one. Then you have a variant of concern. That means it's either able to spread faster, like the Delta virus, or it can be more severe when it does infect people. And then you have a variant of high consequence. That would be one, say, for instance, that can escape the COVID vaccine. And now we all have to start over again and getting a new vaccine developed and getting new vaccinations, which would just be a nightmare. Delta, again, has gone from 10% of the people getting sick with COVID having COVID-19 to over 90%. And the rate of infection has gone up dramatically. In fact, it's doubled in recent weeks. Here's a quick example. Missouri has a low immunization rate, and that combined with the Delta entering their communities, they have 600% increase, a six-fold increase in hospitalizations at one of their hospitals, Cox Health. And Steve Edwards, the CEO, was sharing that patients are younger and have more severe disease than they were seeing with the previous versions of COVID. Very scary. And almost all of them are unvaccinated. We have right now about 1% of people who are vaccinated get reinfected. Whereas we all know that when you don't have any protection and you get exposed, it's a far higher rate that people are being infected. Here's a map at the top. I hope you can see it, where you can see that it started last year in March. That was in New York City. Then what happened, we had a second spike in July when things relaxed a little bit. And then we had that really horrendous spike that came over the winter. And then finally, we got immunizations out and started giving a lot of immunizations in January and February. And look at what happened. Bam, came down dramatically. And we thought we were going to get over it. There was a little bit of a hump in April, but then we thought we were done until this Delta virus hit us. And just like it did in India back in December, India was thought to have reached herd immunity almost by the end of the year. And then all of a sudden the Delta virus hit them, and it was horrendous, and it grew significantly. So as far as if you keep going down, you can see the test rate has started back up. The hospitalization rate has started back up. I'm going to go over that some more in a minute. And the death rate is starting to go back up. So, you've got a 111% increase in cases, 28% in tests, 84% in hospitalizations, and almost 90% in deaths. So this is another very severe, scary uptick that we have to pay attention to. When you look at how many people have gotten vaccinated, about 165 million, which is not quite half of our population. It's actually almost exactly half, at 49.8% are fully vaccinated. We have another 10%-ish that have gotten at least one shot, with 348,000 shots given. And so you can see there that we have a number of people that have gotten a dose, and about 30 million people have gotten one dose but haven't gotten their second yet. So it's time for us to all consider strongly if we should get it. I know you can't give it to children less than 12, but even kids from 12 to 18 now need to think about it, particularly given the fact that there are a lot of pediatric hospitals that are filling up and don't have beds anymore. When you look at the country, you can see different parts of the country have different vaccination rates. I'm down here in Dallas, Texas, and our rate, we're kind of a little dark box in the middle there, or a set of boxes. We're doing okay, but you can see around us there are a lot of people who aren't. Oklahoma does not. Missouri has not. Arkansas is one of the lowest. Louisiana is, in fact, may be the lowest. And they got Mississippi, Alabama, Florida, Kentucky, and so forth. So the Southeast has a very low vaccination rate. And guess what? We see that that the infections in the Southeast are where it is really, really going crazy. And so I'm from Florida. I came out here to Texas, and I don't like friends and neighbors getting sick, dying. It's just not okay. So really encouraging them to look at the data and look at the risk and see that that they have a choice, and we can do something about this. And at this point, the risk of getting COVID and getting sick is so much higher than any risk associated with getting a vaccine. Let's run some numbers on that. Okay, so if you've heard about this myocarditis, muscle inflammation, muscle-itis inflammation. So with the myocarditis, what we see is that when you get COVID, the people who die, 100% of them get myocarditis. Middle-aged people, about half to 2/3 of them get myocarditis. And with young athletes, we find it about 4 in 26 athletes. So, that's about 1 in 7 athletes, 1 in 6 get it. And so when we look at those that are immunized, it's 1 in 3,000 get young athletes have been found to have a transient mild myocarditis. And so 1 in 6 to 7, or 1 in 3,000. And so even though you hear about it in the news, and so it's scary to hear these things, I completely understand and appreciate that. When you really look at the numbers, the danger is getting sick with COVID. It's not getting the vaccine. Same thing with the reports of Guillain-Barré, very, very, very low, very transient. Even the people who got the myocarditis, virtually 100% of them just got well in 2 weeks. And the Guillain-Barré has not been shown to be a significant problem. So, and really, other than that, it's arm soreness, fatigue, some symptoms of getting a shot. Just same things we think about when we get the flu shot, or things like that on a yearly basis. All right. So risk is low if you choose of those things. If you choose to get the shot, that's the point. Now let's go back and look over here at going from left to right. And on the left are the states that have low immunization rates. On the right are the ones that have high. And when you look at the hospitalizations, which is down to the bottom is low hospitalizations, and up to the top is high hospitalizations, you see that Louisiana, Mississippi, Alabama, Arkansas, Missouri, they're amongst the states that are going way, way up in terms of the rate of hospitalizations. You can see to the left, The black line is the average for the United States, and the orange line is what it looks like in those states. And you can see it's just shooting up all across the board, which again, these are good people who don't need to be getting sick right now, and they don't have to be getting sick right now. So I really would appreciate y'all considering strongly getting the vaccine and getting rid of this virus in the country. Here's the thing I mentioned earlier, and that is if you look at the number of squares, 1, 2, 3, 4, 5, 6, 7, 8 squares, that's kind of 8 out of 100 people that were 18 to 39 that got COVID in the earlier waves. But look how that's increased. It's 8 on the second row and 10 on the top. So now 18% are younger. If you look at the 40 to 59, you can see that it's gone up. So it's 2 full rows and 1 square. In the past, now it's 1, 2, 3 rows and a half. So we've got 35% of the COVID cases that are having to be hospitalized now are younger people. And that's very different than it was initially, where we had everybody over 60, basically. Not everybody, but many more people over 60 that were going to the hospital. At this point, we're hearing a lot of pediatric hospitals are saying, we're overwhelmed. We don't have beds. We're going to need somebody else to start taking pediatric patients, which is, again, very scary. And in Louisiana, the commissioner, the state commissioner, has just came out and flat said, we can't take care of people anymore. People are getting substandard care. This is an emergency. It's a crisis. And we have reached our limit. And so people are dying that didn't have to die because they can't get good hospital care. So you do not want to get sick right now if there's any possible way you can avoid it. If you look at the dark lines here on this scale, what you see is that the dark line that is the number of cases. And you can see that in the counties where people are not vaccinated, it's gone crazy. And the death rate, which is the orange scale, has gone up dramatically. On the other hand, the deaths per 100,000 people in those highly vaccinated counties, you can see have been pretty low. It is starting to tick up a little bit, so we'll want to watch that carefully. But the cases, too, have been significantly lower than where people haven't. So when you get vaccinated, you don't just help yourself, you have to help your family, your neighbors, your coworkers, and your community. So here's, again, you can see areas where not a lot are vaccinated. And now you can see where the cases are appearing. And here's hospitalizations, and you can see hospitalizations are here, a lot in the Southeast. And finally, here's deaths. Now, there's a lot of deaths up in New York. That's where we had the big, outbreak last year, and a lot of people died. Now what we're seeing is the whole Bible Belt and South is starting to pick up and get darker and darker. And I will tell you, I have 24 companies I work with that I have the pleasure of giving advice around their COVID strategies. And I've seen many good people die. And these are hardworking, fit, athletic men that are working in oil companies or in trucking or in manufacturing. And you wouldn't think they have a problem, but literally standing next to the bed when people die of COVID is not something you ever want to do. And you probably couldn't, because they won't let people into the room to even be with their loved ones when they have COVID. The other thing is that the hospitals are filling back up. The place I've seen most people die is after they're in the hospital, they get discharged to LTACs, or long-term acute care facilities, where the ratio of nursing is very low and they don't get the care they need, and they get blood clots and other problems. So it's not just the hospitalization, it's the care you get afterwards, and it's scary and it's traumatic, and we don't want that to happen to you. And it's happening a lot more than it needs to right now. Up in Arkansas, they've been devastated, and one of the things that's happening is that you're seeing a lot more people get immunized. So if you were one of those people who maybe spoke out strongly against it, I will tell you, back in November, I said, there's not enough evidence. They developed this quickly. I'm not comfortable. I will not make my decision on whether I get immunized or not until at least 20 million people have been immunized, and we can see what's going on. And so when I got the data, we saw the 20 million. It actually was exciting to see how safe it was, safer than, really as safe as any vaccine we ever had. And as a result, I went and got my vaccine early in 2021. don't be fooled. When you look at the number of people who died in 2020 around the world and the number of people who died in 2021, we're halfway through 2021, and we already have surpassed the number of people who died in 2020. So this is a horrible illness. It's an aggressive illness, and it's killing people. And you don't know whether it's going to be you or your neighbor when you get sick. So please protect yourself. Some people, it's a cold. It's amazing how they aren't affected at all. And some of the people you'd expect to go down hard don't even get sick. And then other people who you would never have thought they'd have a problem because they're fit, and they're young, and they're healthy, end up getting very sick. So let's not take the chance unless under any circumstances. As I mentioned, I'm from Texas, and this is, I wanted to show you this. This is the COVID CDC.gov tracker, and it's looking at how many people are sick, and you can see the level of community transition. It goes from low to moderate to substantial to high. We last week were in high, and you can see we've had a 50% increase in cases. We've had a 25% increase in deaths. We've had a 1% basically increase in positive tests. And so we're, in a very disconcerting place. And we have high vaccination rates in Dallas, relatively speaking. In fact, we thought we had reached, between the vaccination rate and the sickness rate, we thought we had reached herd immunity about a month ago. And it is not protecting us right now from this new Delta virus. So what has the CDC said? There's a lot of recommendations coming out. I just want to quickly go through them. And the bottom line is that you have two populations of people. You have the vaccinated, and you have the unvaccinated. I'm going to focus on the changes on the unvaccinated people right now, because if you are unvaccinated, then basically, if you don't want to get COVID, you almost have to stay indoors because it is so infectious. If you get out and about with other people, there's a very strong chance you're going to get sick. So you want to isolate as much as you can. They've been saying 6 feet is far enough, but with the new Delta variant, that has been called into question. Does it need to be 8 feet or 10 feet? Because it is so infectious. The wearing a mask, again, has been shown to be helpful, but this virus is so aggressive that we're concerned that if it's not a tight-fitting mask all around, that there still may be some that get out. So that's a bit disconcerting. And so you'll want to wear the best mask possible and make sure you have a good seal. And so, and then if you do get exposed to somebody and you're unvaccinated, you have to go home and quarantine for 14 days, or you have to go home and wait till the 5th day and go get a test, which again is going to expose you to people. And if that test is negative, you could go back to work at day 7, or you could go back to your normal activities on day 7. For those who are vaccinated, on the May 16th, they said you can resume your normal activities, but then they've had to cut back on that because of this terrible surge. And on July 27th, the CDC said that we need to start wearing masks indoors in public, and particularly if you're in the right side of that where it was substantial or high transmission areas, you need to be much more aggressive. And wearing a mask is the best thing that we have, and it's particularly important if you have an immune compromised disease like rheumatoid arthritis or multiple sclerosis, if you're taking any of the things like Remicade or Enbrel, any of those type medications, you really have to be careful because you're at increased risk for getting very, very sick. The other group of people that are at increased risk are people who have a beer belly or tend to be what we call metabolic syndrome, which is very highly correlated with going to the hospital or dying. And it's the pre-diabetes, pre-hypertension, diabetes, hypertension, heart disease, congestive heart failure, things like that. You're at very high risk, so you've got to be extremely, extremely careful. Or if anybody in your house has any of those things, you're going to want to be very careful. Travel in the United States is still unrestricted, and you just want to be very, very careful. If you get exposed to somebody, you don't have to go quarantine now every airline flight, but if you get exposed or you could have gotten it through close contact, then you do have to go back and take care of yourself. International travel is changing daily, and so you're going to need to keep a careful eye on what they need. Do they need a test before you leave? Do you need to bring your immunization card? All of those things, you've got to be prepared. On the 28th of July, it was announced that people who are fully vaccinated, when you have a close contact you can wait 3 to 5 days. I tell my patients 5 days is best, but if you really need to hurry back to work or taking care of your kids or something, then think about doing it on day 3 or 4. And if that test is negative, then you can strongly consider going back to your life if you have not had any symptoms at all. But you still have to take very aggressive precautions because many people who have been immunized and or vaccinated that get sick don't know that they're sick, and they're releasing the virus, but they don't know they're releasing the virus. So your business and workplace, they have the right to do things more aggressively. I know a number of companies now are considering making people get vaccinated before they come back to work. And that's something you're going to hear more about because there's such a big difference between being vaccinated and not vaccinated. If you're not vaccinated and you get COVID, 1 in 12 go to the hospital, 1 in 60 die. If you are vaccinated, 1 in 250 go in the hospital. 1 in 12, 1 in 250, and 1 in 1,250 die, whereas 1 in 60. So when you're an employer and you care about your employees, which everyone does that I work with, then the question is, wow, how do we have the workplace be safe when people are choosing not to get vaccinated? Because it's a completely different dynamic than if you have a population that is vaccinated, where the chance of them getting sick is very low. About 1% right now are getting sick. And if they do get sick, the chance of them ending up in the hospital or dying is very low. So the vaccine's doing what the vaccine's supposed to do. We just need to make sure that all of us look at that situation and make the best choice for ourselves and our family. And whenever possible, strongly consider getting the vaccine. All right. So when you travel, you've got to protect everybody around you. Remember, even if you're vaccinated, you don't know if you're sick. So you've got to protect other people by staying 6 feet away, wearing a mask, washing your hands. And the symptoms with Delta virus are different than the original COVID. The original COVID, it was a lot more upper respiratory and, moved into your lungs, a lot of coughing, loss of sense of smell frequently. And I think over 50% eventually lose their sense of smell. With Delta, it's much more like a cold or allergies. So people often say, I just have an allergy problem, or I just have a cold. And lo and behold, when they get tested, it's COVID. So you have to be very, very careful and make sure that you're protecting the people around you and protecting yourself. So for now, please be careful. Please realize if you're unvaccinated, you're very, very high risk. I'm very worried about you. And I hope that you'll strongly consider protecting yourself and your family. And if you are vaccinated, you still have to be very careful in protecting other people around you and protecting yourself and your family. So what are the keys to ending the pandemic? Well, we really, at this point, we've exhausted people. The mental health crisis we're having in the United States right now is real. People are tired of this pandemic, social isolation it brings and things. So it's important for as many of us as possible to get vaccinated because then we can keep things moving. If we have a large percentage, like the 50% in our country right now, who won't get vaccinated, there's a chance we could have to close the community down. And I don't think any of us want that. But if folks will go get vaccinated, and there are a lot that are changing their mind right now, so well done. If you're one of those, then we'll be able to keep our communities open and protect the vulnerable amongst us. Keeping up is really important, and it's important that you read things all across the spectrum. We have this phenomenon in the United States where people get turned on to somebody they like and they only read what that person says. And that person may be very, very wise, or they may have an opinion that they're expressing that isn't consistent with data and science. And that's on both sides. It's not on one side or the other. So make sure to stay up to date. Look at the resources that I provided links to in this. They're just scientific dollars and numbers, and that you can keep up with what's going on through them. So it's very important. Follow the 3 W's, wear a face mask, wait until you maintain a distance of a minimum of 6 feet, and wash your hands often. And if you do choose to get the vaccine, please get it quickly. There are a lot of people who change their mind. Again, I was one of them. I was very unsure, and then with the data, I decided to. And one of the other things I want to mention to you that has bothered me, but I've done the research on, so let me share it with you, is that this is emergency use only vaccine. It's not completely FDA approved. And so I was, why? Why? Do they know something? Are they holding something back? Should we be concerned? And when I went and did all the research, in the normal process of approving a vaccine, it would be approved next spring, is when you would get full authorization. So it's exactly where it should be for one that was created and is being used under emergency authorization. Obviously, they're trying to work harder on that and not have the slow bureaucratic process that we've suffered with for the last 200 years and get it approved. So hopefully we'll be getting that soon. And I know that will reassure a lot of you, but the data is already in. As far as I'm concerned, as a scientist, as a researcher, as a doctor, man, I have seen many, many people get very, very sick. And and now that we don't have to have them at risk, it's time to act, because I've seen, obviously, I've had all my patients. I've had myself, my wife, my children, everybody in my family who listens to science and is open to following the science get vaccinated. And while some had sore arms and were fatigued, including myself, it is so much better than getting sick with COVID. And it is far, far, far safer. So I really strongly encourage you to look at the data, look at the science, and do what's best for you and your family, your coworkers, and your community. Thank you so much. I hope this was helpful, and I will be available if there's any questions that come up.